My name is Bridget Quast. I'm an occupational therapist with the Medical Support Systems and Tender Touch team here in Oak Creek, Wisconsin. In a few minutes, we're going to start our live presentation on Midline-Crossing. So I'll just give people a chance to join in, and I'll see if I can make sure that I can see any chats that come in. Forgive the difficulties with figuring out camera angles and such. Well, it looks like I'm going to have to hold on to it. Just another minute now and then we'll start. We'll go ahead and we'll get started. Again, my name is Bridget Quast. I'm an occupational therapist. I'm at the Oak Creek, at the Oak Creek Clinic for Tender Touch Therapy and Medical Support Service. I'm an occupational therapist, and today I want to talk about midline crossing. Midline crossing is an important neurological foundational skill. It's an activity that happens anytime one part of the body reaches across an imaginary line drawn right down the center and reaching into the space on the other half of the body or the other half of your world. This skill of reaching across from one side to the other is so important because it helps different parts of the brain work in coordination or collaboration with each other. That can improve, the synthesis of skills, hands and eyes working together or hands and feet working together, as well as specialization for dominance, for example. When a person has one dominant hand and can improve that skill with that dominant hand, that makes it so that you have one very skilled hand versus two mediocre hands. So how could you tell if your child had a difficult time with midline crossing? One of the signs of impaired midline crossing would be a poorly defined hand dominance. Now, that being said, hand dominance is not something that's truly selected until you are at least 6 years of age. It can be very fluid up until 6, but definitely by 6 you want to see that a kid or a person has a dominance selected. Oftentimes kids switch dominance when they're small because they're not quite sure, those pathways haven't been established and they're not quite sure if what they're experiencing is discoordination or fatigue. So they don't often stick with one hand. Another sign of poor midline crossing would be a poor coordination of both hands together for a cooperative two-handed task. Naturally, these come around as a person gets older and builds the skill, but think of buttoning, zippering, something where you need coordination of two hands. Poor coordination of reciprocal or alternating movements can also be a sign of impaired midline crossing. So think the rotational activity of riding a bike. Part of the difficulty of riding a bike is balance, of course, but if you can't use those same skills you use for midline crossing to turn on one muscle of one side, turn off and then on, and then off, and then on, you can't get that reciprocal motion. Another sign of poor or impaired midline crossing would be twisting or shifting in one seat when they are trying to do a task that you're supposed to do head on. And often this comes to light with handwriting in schools, that a child has a difficult time sitting perpendicular to their work, or parallel to their work, and instead they get themselves perpendicular to their work. Also, you see this with some kids that have a difficult time sitting at the table to eat a meal. Instead of being straight on with their plate, they'll sort of twist their body and eat kind of on one side. And you can see where just with me being in this position, that shows you how impaired the midline crossing would be, because if you were straight onto your plate, you would do a little bit of rotation and crossing midline to go get your food. Another big midline crossing issue that is present, once again, in schools, or more present in schools, are kids who start their work, their handwriting, right in the center of a page, or can't get all the way to the left to start when they're writing their assignments. So what can be done to improve midline crossing? Well, there's a lot of different bilateral midline crossing activities. You can start with activities where you're just supposed to meet one side from the other, or one side with the other, for catch, for example. Coordinating both sides to come together in a collaborative way to catch a ball. Pushing or pulling activities. So I know Jenny talked about in Tuesday's session about sensory play and putting a kid in a laundry basket and having them push or pull for hard work. That same sort of thing becomes a midline activity when you are pushing that laundry basket full of books, or push the grocery cart when we're all permitted to go back out to the grocery store. But push the cart or pull a box of books or stuffed animals or something to really get that push and pull motion where it's cooperative and equal from both sides. Tabletop games or stretches where two hands can come together. We often have kids do these sorts of stretches if there's weakness in the shoulder or if there's weakness in the core, where they can, I'll give you the side view, push forward and then pull back. Back up a little for you. Push forward and pull back on a tabletop. You can see my hands are together, so that's going to be a collaborative or cooperative activity with those hands together in the center. Other good midline crossing activities are rotational tasks. So you can, I've got a ball to show you one here. I like to do this with kiddos and their siblings. Have kids sit back to back, pass the ball to one another, and then the other one comes and passes it back. And you can just go around in a circle like that. But you can also set up, if you have a child who's not able to sit independently, you can think of a rainbow arc around your child. Start setting up toys in an arc area around your child so that they have to reach to get things, and don't let them scoot on their bottom to make sure that it's always only one hand that they're reaching with. Really stretch to come across their body to get things. Another thing that I like to do is have kids draw in an arc. So if they are kids who are able to be placed on their tummy, or if they're kids that are at the tabletop, try to get as big of a piece of paper as you can, or string together pieces of paper and have them draw rainbows. Do it outside in chalk, and don't let them continually twist their body. Have them make a big sweeping arc from one side all the way to the other. We had talked at the beginning about the use of an arm bike or a leg bike for the rotational activities. Once again, that's something that can be done pretty inexpensively. They make little portable arm bikes and leg bikes that you don't have to be out in a bicycle that's a street-worthy bicycle. And that's something that could be done even for a child who's in a wheelchair. That could be mounted on a tabletop, and then they can get that rotational activity, or I'm sorry, reciprocal activity on the tabletop. Fine motor activities that you can do for midline crossing. One of my favorites is a warm-up for handwriting called Lazy Eights. And it's best to do this with it right in front of a child, basically so that their nose lines up with the center of that 8. But I'm going to be on a little angle here so that I can show it to you. With this activity, it is not about accuracy. This one's about fluidity. So I encourage kids sometimes even to close their eyes. You'll see kids with difficulty with midline crossing or with motor planning issues that can't follow that pattern, and they just start doing a circle over here, or they just start doing an oval over the whole thing. If that happens, just gently have your child stop, start them again with the center, and do hand over hand for a while, get them warmed up, and then try to just let them go to see if they can continue on. This one is pretty challenging for a lot of our kiddos, but it's a nice fine motor warm-up. Anytime we're talking about motor skills, gross motor or big motor movements, big muscle actions happen first, and then we develop our fine motor, small muscle movements. So before you go to something like a fine motor warm-up, let's do a gross motor warm-up. So I'm going to back up a little here. So cross crawls are a good fine or gross motor warm-up. That's going to be the elbow of one side to the knee of another. Make sure that your kids get a twist. I'm trying to do this from my knees, so I can't really get up. But also old-fashioned windmills, so just standing. And even if your child is not able to stand, and a lot of these take balance, even if your kid is doing these seated, you can still get that rotational experience in the trunk that's going to give you that midline crossing. And if you have to help with pushing a little bit into the twist, that is okay. They will still get that benefit, even if you're physically helping them to get that movement. Windmills, cross crawls, air punches. So, you could have a pillow that they reach for, or a balloon that they tap, but you could keep moving an object left and right and make sure that they're using the opposite side to touch that object you're leaving. Another good way to help strengthen midline crossing is to have a child use their dominant hand for dominant hand activities. And at the beginning, I talked a little bit about the use or the development of fine motor coordination, dominance, selection being related to midline crossing. and that a lot of kids who struggle with midline crossing also struggle with fatigue, and they will stop using a helper hand and when their dominant hand fatigues, and they'll switch and they'll start coloring or drawing or writing with their non-dominant hand. Encourage kiddos who have this to take a break and not to switch dominance. You really want to let that dominance settle in their brain and really let that selection of dominance happen before the age of 6 or around the age of 6, so that their brain can solidify those and strengthen those patterns. So make that helper hand a helper hand, and don't let it become the dominant substitute. Another good thing to look at when you're talking about strengthening midline crossing is to improve core strength. Oftentimes, a weak core ends up undermining that selection of dominance. We get kids that their core is weak. They will be writing, coloring, drawing, using scissors, and as they are doing this bilateral task, 2 hands together, they start to fatigue and they start to sort of melt. And then pretty soon one hand is holding their head up and the other hand is using the scissors. Well, you don't really get to enrich those skills with the dominant hand if the other hand is holding up their body. So once again, if you start seeing that, because that will have a second order effect on midline crossing, have your kiddo take a break. Better to take a break for a minute or 2, come back a little refreshed with that core ready to work again. Other core activities that you can do, push-ups, sit-ups, crunches, certain yoga poses, bird dog and plank are good ways to strengthen the core. All right, that's what I had for midline crossing. Let me see if I can take a look at any comments. Any questions? Anyone have anything specifically that they want addressed for midline crossing? I hope that I could see those. All right, well, I'm afraid on my end I don't see any questions, but certainly if you have any questions, you can post the questions here and we'll get back to you with those. I thank you for your time today, and good luck with midline crossing. Take care.